You have been stretching your back, taking medication, maybe even getting injections for sciatica, and your burning leg pain is still not improving. After working with hundreds of people who were told their pain was coming from a pinched nerve in the spine, I started noticing a clear pattern. Many of them were treating the wrong problem entirely. In this video, you'll learn the overlooked condition that often mimics sciatica, how to tell the difference in just a few minutes at home, and 2 specific exercises you can start doing today to calm the burning leg pain. I will also explain a non-surgical option that most patients are never told about that directly targets the cause of the burning leg pain. If you feel stuck, dismissed, or starting to wonder why nothing is working, stay with me. By the end of this video, you'll know whether you have been targeting the wrong source of your burning leg pain and what to do next. I'm Dr. Cordova. I've been a chiropractor for over 29 years, located here in Houston, Texas. I've helped thousands of patients with disc bulges, sciatica, and leg pain get their life back without surgery, using chiropractic, spinal decompression, and other therapeutic modalities like pulsed electromagnetic field therapy. Here's one of the biggest clues that your burning leg pain may not be coming from traditional sciatica alone. Pay attention to what makes your symptoms worse. If the burning builds the longer you stand or walk, but starts easing when you sit down or lean forward, there may be something else contributing to the problem. Many people notice they can only walk short distances before the pain, cramping, heaviness, or weakness starts building in the legs. Some unconsciously lean onto a shopping cart while walking through the store. Others brace themselves against the kitchen counter for relief. And interestingly, sitting down for a few minutes often calms the symptoms. That is very different from classic sciatica caused by disc compression, which is usually aggravated by sitting and bending forward. What many patients do not realize is that standing and walking pattern is commonly associated with a condition called lumbar spinal stenosis. Lumbar spinal stenosis is a condition where the space inside the spinal canal in the lower back becomes narrower, placing pressure on the nerves traveling through the lumbar spine. This narrowing is typically caused by permanent structural changes in the spine, including bone spurs, thickened ligaments like the ligamentum flavum, and sometimes even disc bulging or herniations. As the space tightens around the nerves, symptoms often travel into the legs instead of staying only in the lower back. Many people experience burning pain, cramping, tingling, heaviness, numbness, or weakness that gets progressively worse while standing or walking. One of the most interesting clues is what happens when patients bend forward. Many people with lumbar spinal stenosis notice temporary relief when leaning over onto a grocery cart, countertop, or railing. That relief happens because forward flexion temporarily expands the diameter of the spinal canal, reducing pressure on the compressed nerves. Burning leg pain is often automatically labeled as sciatica, especially if an MRI shows a disc bulge or herniation at L4, L5, or L5S1. And while disc compression can absolutely cause sciatic nerve pain, the symptom pattern is usually very specific. Sciatica caused by disc compression happens when a bulging or herniated disc places direct pressure on a spinal nerve root. That compression creates burning, shooting, or electric pain that travels from the lower back into the buttock and down one leg along the path of sciatic nerve. The symptoms are typically aggravated by sitting, bending forward, coughing, or sneezing because those movements increase pressure on the irritated nerve root. But this is where many conditions get mixed up and mistreated. Lumbar spinal stenosis can also create burning pain into the legs, yet the pattern is very different. Instead of worsening with sitting, the symptoms often build while standing or walking. Patients describe heaviness, cramping, fatigue, or burning in the legs that improves when they lean forward or sit down. Same general area of pain, completely different mechanical cause underneath. Once you understand how lumbar spinal stenosis behaves, the symptom pattern starts making much more sense. The positions that tend to relieve the burning are usually the same positions that temporarily create more space inside the lumbar spinal canal and reduce pressure on the nerves. That is why many people naturally lean forward onto a shopping cart, countertop, or railing without even realizing what their body is trying to do. And with that in mind, I want to show you 2 simple exercises that may help reduce pressure in the lower back and calm burning leg pain associated with lumbar spinal stenosis. The first position works by placing the lumbar spine into gentle forward flexion, which may temporarily increase space inside the spinal canal and reduce pressure on irritated nerves. Many patients with lumbar spinal stenosis notice that this same forward-leaning position is what naturally gives them relief while sitting or walking. That is why this exercise can feel especially helpful during flare-ups of burning leg pain, heaviness, or cramping in the legs. The movement should feel controlled and comfortable. You should never force yourself deeper into the position or push through sharp pain. If any of these movements increase your back pain or leg pain, stop the exercise. Only move within a range that feels comfortable for you. All right, so we're going to do seated forward flexion as relief. Remember, we're trying to open up that space. So it's one thing if you find that you're just doing this and you're getting some relief, the rounding of that back, that's great, but let's go ahead and give it some more. So we want to just slowly reach forward for the toes. So you can go between the legs here, or you can be on the outside and bend forward. And all we're trying to do is find some space. I find if we're holding here across the knees, we can open up that back space even more. And it's just a gentle fold forward. And you'll start to feel some relief and some tractioning as that back space opens up. You want to hold it for about 30 seconds or so. You can definitely hold it longer if you need to. And once you get some relief in there and you start to notice that some pressure is taken off, that's when you really want to try to reach forward even a little bit more. If you don't make it to your toes, that's totally fine. We just want to be able to hold it and create some space. This is not like a quick bending forward movement. We're trying to do a long, sustained, opening stretch that really makes a big difference there. The next exercise is called the 90-90 relief position. This position is designed to reduce pressure on the lower back by removing gravitational load from the lumbar spine while allowing the muscles around the hips and lower back to relax. Many patients find this position especially calming during episodes of burning leg pain, heaviness, or nerve irritation because it combines spinal unloading with gentle hip flexion. This may temporarily reduce pressure inside the lumbar spinal canal. The goal is to let the lower back fully relax without straining or forcing the position. If this movement increases your back or leg pain, stop the exercise. Only hold the position in a way that feels comfortable for you.
Okay, so we're going to do the 90-90. This is to work on some pulling and some traction in your back, as well as giving your hips a rest. I usually will do this on a couch, or you can do this on a chair at home. And all we're going to do is come up and swing our legs up here. And we want this to be at 90 degrees. Now you can just lay here 10 to 15 minutes and just relax. What you'll feel is this pulling that's happening through here. And then the other thing I like to do is, as I'm in this position, I'm just going to kind of gently sway my hips back and forth. Sometimes you'll feel a pop in your back, and that's okay. We're just getting movement in there. Since there's no force in there, and then it's totally fine. But really what you're going to feel is that pulling. That's really what you're going for. So this should be a very rested position. And so you don't have to do anything if you don't want. The key is just to let gravity do its thing, and the pulling of your legs will open up this joint space, and we're just going to relax here. So lay here 10 to 15 minutes. I would do this every single day just to help your back, and it should feel much better when you get off there.
For patients dealing with persistent burning leg pain from lumbar spinal stenosis, one treatment that is often overlooked is non-surgical spinal decompression. Non-surgical spinal decompression is performed on a specialized table that gently stretches and unloads the lumbar spine in a controlled and precise way. The goal is to reduce pressure on irritated nerves and improve space within the lower back. For patients with disc bulges or herniations at L4, L5, or L5S1, decompression may help reduce pressure of the affected nerve roots. And for patients with lumbar spinal stenosis, the gentle separation created during treatment may temporarily increase space inside the spinal canal, which can help reduce burning, heaviness, cramping, and leg pain. One reason this can be helpful for lumbar spinal stenosis is because the treatment may also help stretch and flatten thickened tissues along the back portion of the spinal canal, including the ligamentum flavum. In many stenosis cases, these tissues can thicken and buckle inward, contributing to nerve compression while standing upright. Creating gentle distraction in the lumbar spine may temporarily reduce that pressure and improve comfort during and after treatment. The treatment is non-invasive, does not involve surgery or injections, and many patients find it comfortable and relaxing during the session. As you can see, burning leg pain is not always coming from traditional sciatica. The symptom pattern matters, and understanding what makes your pain worse or better can provide important clues about what may really be contributing to the problem. You now understand the difference between disc compression sciatica and lumbar spinal stenosis, and you have two exercises you can start using at home to help reduce pressure on the nerves. You also know about non-surgical spinal decompression and how it may help relieve burning leg pain by unloading the lower back and creating more space around irritated nerves. And remember, it is always smart to get evaluated by a qualified healthcare professional with experience treating lumbar spinal stenosis so you can receive an accurate diagnosis and the right treatment approach for your condition. If you got value from this video, make sure to like it and share it so other people dealing with burning leg pain can get the relief they need. And the next video you should watch is this one right here if you want relief from leg pain while sleeping at night. Go watch this video next.